Sharing feels really challenging right now, but that's also why it feels super important. In the past about 2 weeks now, I've been having a lot of trouble breathing. Nobody's really sure why, whether that's related to some ongoing pancreatic inflammation I've been experiencing, which no one is really clear why, whether or not that's a co-infection called babesia, or whether that's due to the inflammation I've been having in my pancreas now on kind of a long-term basis since September. Some of the levels keep slowly rising. Not enough to be acute, but enough to be uncomfortable all the time. Yeah. I feel quite vulnerable as this symptom worsens. It's very challenging for me to sleep. My family doctor, that's a GP if you're in Canada, took one look at me and sent me to the emergency room, which if you are a chronic Lyme person, you know it's like often fruitless, but I can understand that the desire as a doctor to, cover all bases, and when you have a patient that comes in this short of breath, what are you to do? They x-rayed my lungs and don't see any specific blockages. It sent me back to the GP, so I've been chasing my tail, and my current treatment for Lyme, the naturopath and the internist don't know what's happening. I have a puffer that I'm too scared to use because it can cause anxiety and heart palpitations, and really my greatest MO right now is like to be as chill about it as possible, because if I get worked up about the fact that I can't breathe, it just tailspins me into a panic. I would say that the go-to right now is to stay calm, to pray. That prayer comes in the form of leaning into trust that the perfect help is happening at the perfect time and that I'm okay. And laughter helps. And with the constant mantraing to stay calm that I'm okay, also to really give myself permission to feel the feelings of it. Not feeling okay. Because nobody really has an answer, and I have a fever every day, and my glands are swollen, and having a really hard time breathing. And I'm scared, and that's okay too. I have a tendency to strong arm, and I would say do what feels like the most open-hearted, and the sweet spot, the softness comes when I can really surrender, and a lot of times that's to give myself permission to be scared and let that come in waves. Also, to feel those feelings. we're heading into what would be 6 months of treatment, but as I mentioned, there's not a lot of clarity about why this is so challenging right now, and there's a lot of things being pulled from my protocol and kind of dropped in just to see where it lands, and things feel really messy. New symptoms scare me. Thank you so much for watching. It feels really important to share. And to touch in, create this window from my little bedroom. Yeah. And we find our breath and the permission to be where we are with all the feeling, senses, and softness together. Thank you, thank you, thank you, thank you.